is a bit of a kind of virtual conversation, open day for those of you who have been offered a place on MSc DDI and anybody else that's decided to join us. So we're wanting to be here to answer your questions, just to fill you in on our plans for September and how we're going to be delivering the course, and to really have a conversation and try to meet you a bit. The way this works is that we will have our the panelists here will have our audio, and we'll be able to talk to you. And if you want to talk to us, because there are so many of you, then we ask you to use the chat. But if you've got specific questions to ask, then please put those in the question and answer box, which I hope you've been able to find. So if you could let me know on the chat if you can't find the question and answer box. There's a two speech bubble icon next to the chat icon at the bottom of the Zoom window. You should be able to find it there. Okay. Right, it's very good to meet you. Let's do some introductions. So first of all, I'm Dr. Tim Adlam. I'm the Director of MSc DDI, of Disability Design and Innovation, and I'm looking after our session this morning. We also have with us Catherine Holloway, Dr. Catherine Holloway, I think at the moment, who is our Academic Director for the Global Disability Innovation Hub, and leads the Academic Research Centre that forms part of the hub. And she also teaches a module on accessibility and assistive technology, which is part of the human-computer interaction MSc, as well as being part of DDI. So Kathy's on board, and she'll be able to help you, those of you who've come from MSc HCI, on what the differences and similarities are between these two courses. Dr. Youngjin Cho, he is a lecturer on the course as well, and also part of the UCLIC academic community. And he teaches research methods and making on the course. And we're not missing out making, even if you're working with us online. That's going to be part of the course. We also have Kate Mattick, who is one of this year's students. And Kate has a little bit of a story to tell us about an award that she's won and some of her work that she's done. But she'll also be able to help you with perhaps some more of a student perspective on the course as well. And then last but not least at all, we have Aisha Bayat, who's our administrator on the course. And Aisha makes things work. She's a point of contact for processes and so on and things as well. So it's good to have Aisha with us as well, and she will also be able to help you with some of the questions as well. Then the last person we have on our panel is Louise Gebert, who is helps us with our promotions and our marketing, and helps with running some of the admissions work. Okay, so that's everybody. Let's just make a start and start to talk you through what we're doing with MSc DDI. MSc DDI is about making a difference in the world for people with disabilities. It's about training up a group of people who are equipped to be able to address and solve complex problems that are faced by disabled people, and to be able to speak to all the different stakeholders involved in those problems, from people with disabilities themselves, clinicians, to work with other designers, to work with service providers, to work with policymakers. And what we're aiming to do is to build a community which can go from DDI into the world where disabled people are living, working and playing, and influence and affect and lead effective and design and innovation, and the creation of new technologies and new services and new policy frameworks and so on. So that's really what we're here for. That's what we're equipping you to do, is to be effective problem solvers. And to do that, we have three universities who are delivering the course, working together. So you come away with a UCL degree, and UCL is delivering some of the modules. So we deliver modules on future global technologies for disability and development. We do the research methods and making. We do the accessibility and assistive technology, and we do the module on inclusive design, which is an option module in term 2 along with AAT. Then the Loughborough University London, they deliver our design thinking modules. So they have 2 modules, one in the first term, which is about design thinking. And this is not a product design or an industrial design course. This is a course on processes and methods for designing anything. These are skills that are transferable, and they can be used in product and industrial design, but they can also be used in service design or policy design and other problem solving contexts as well. So that's what Loughborough will be delivering. And then in term 2, Loughborough deliver a collaborative unit, which is teaching you how to work collaboratively and how to work with other people. And that's an externally connected project, which we do with partners around. And then the London College of Fashion, they deliver a module in term 2, which is again another core module, which is about business and marketing in development. And so we're looking there at providing you with skills around creating businesses, around creating innovations, and getting those up and running and working in the context, in an international development context, and with the purpose of transforming communities and the lives of disabled people. Okay, so that's a brief summary of MSc DDI of what we're delivering to you. Have we got any questions at this point that you'd like to ask? Okay, no questions. Can just also to check, can you all hear me okay?
It's fine on my end, Tim. I can hear you clearly.
Right, that's good. All right. So let's just move on then. One of the questions. Thank you, Alnud. There's a question. So right, yes. So core modules with Loughborough and the University of Arts London. Are you having classes with them at their campuses? The answer with that is yes. If you're in London, then that's what's running. But those will, that's right. So our lecturing and our content delivery, we are doing online. So we're not doing lectures face to face because of the COVID situation. We're delivering the course through online methods. We're doing some tutorial tutorial sessions where we can answer questions and work with you in groups like that, and we were running some seminars and some discussions and so on as well. Then we will also be running some face-to-face sessions for people who are in London, but those will be additional to the core learning content, as it were. So if you're not attending London, you will be able to access the entire course. There won't be any learning objectives that you are not able to do. Regarding Loughborough and University of Arts London, we would normally be doing classes at their sites, but on this occasion, because we are in a COVID situation, we're not running lectures with Loughborough or UAL. We are developing a program of some face-to-face activities, and I hope that Loughborough and UAL will be involved in doing that delivery. That's the plan, that we'll have some involvement there too. Okay. So the next question then is, how can this program be related to mobile application development and software engineering as well? Kathy, could you answer that one for us?
Sure. So we don't do a huge amount of what I would call software development. So we're not teaching you software engineering skills. We're not doing databases. That's not what we're here to teach. So as Tim mentioned at the beginning, this course kind of grew out of the MSc Human-Computer Interaction, where we realized there was a huge market for more accessible and inclusive design practices. And so within the mobile application development, what we focus on is the human-computer interaction elements. So that means how disabled people might interact with the technology. So for example, with a mobile phone, and how we assess apps. We develop apps, but mostly it's with the user-centered design aspect. On top of that, we do work with, for example, GSMA, so Kate can speak to some of the talks that we gave. We did work with GSMA on large surveys on how disabled people globally use mobile phones, where the market gaps and opportunities are, as well as opportunities in the high end for development of new mobile applications. People who've come on the course that have a software background before have gone on to develop or can develop in their dissertation or in research methods of making. You can develop an app, that's not a problem. It's just we will teach you how to do, as Tim said at the beginning, how to solve problems and how to apply design thinking to issues. So if that's about mobile application development, then it's really about understanding what the application is trying to solve, what the business opportunity is, and how people will interact with that technology. One further point is just to say that we do a lot of work on the kind of systems approach. So a lot of times assistive technologies or technologies for disabled people like mobile phone applications are developed. They're not developed within the system in which assistive technologies are used, like the actual lives of disabled people. So we're very focused on actually how do people live and what is most useful. So we look at that as well. I can send you, or maybe Aisha, you could share a couple of links from some work that we did before. Is that sufficient, Tim? Anything else you'd like?
Yes, you had another question, Kathy, which you flagged you wanted to answer.
Oh, I just pressed the wrong button. My first time using Q&A.
Okay, that's right then.
I think maybe Yongjin would be best placed to answer that. I can answer it, but Yongjin would you like to answer?
Yeah, Yongjin, can you talk about doing the practical work and how we're going to enable people to do making?
Yeah, so that's a really good question. So at this moment, there seems to be some difficulty in accessing to the facilities, especially the laser cutting or 3D printing facilities. But we also do have lots of prototyping activities within the research method and making skills and other modules. So one is about software programming, prototyping, which Cassie already mentioned. And the other part is about the Arduino programming. So physics prototyping will be also included in the coursework. So for that, we will be having multiple mentors for our students. So students will be grouped for mentoring sessions and tutorial for learning about how to make things to do with Arduino and the physical prototypes and so on. So in that case, we have been still figuring out how we can deliver face-to-face tutorial. At the same time, we are also considering providing some remote based tutorial. So there are lots of digital tools which students can easily use in prototyping. So like one example is, so software-based Arduino, the graphic GUI-based Arduino programming. So our TAs, teaching assistants, will be also helping you to use such a program and how to develop the prototype better. And also the other component which I need to highlight within the my module is coursework. So coursework will be done individually. So everyone will be working on their prototyping and research activity by themselves. But like I said, mentors, including me and TAs, will be helping you to shape your prototype better.
Okay, thank you, Yongjin. So there's a question there about the online preparatory course for students from non-engineering backgrounds. So Kathy is looking after that course and developing that at the moment. Could you just explain a bit more about how that course is going to work, Kathy, please?
Yes, it's just going to be a very simple, we're just deciding whether it will be 1 week or 2 weeks module that will allow you to take, using a mobile phone or a dummy data set, learn how to do the very basics of programming. So we have data that we've collected before from wheelchair users in India and in London, where people have had sensors on their wheelchair, a little bit like a Fitbit for wheelchair users. And so we're going to use that data to explain how you can graph data, how you then make sense of data, how you filter it, and also how you begin to visualize it. And through that, we just teach the very basics of learning how a sensor gives you data, how to clean that data, how to make it, and how to visualize it and make sense of it. And then there'll be a kind of an additional thing that, provided people have a smartphone, they will also be able to collect their own data set and begin to play with the data. So basically the main things are just to understand, for the people who've never done computer science, to understand key concepts like what are variables when you're doing coding, what are loops, how do you maybe read in 4 or 5 different files and then work on the data from the 5 files all together. It's relatively simple. It's quite fun. We're trying to make it a bit fun, and hopefully you'll be able to work in teams of 2 to 3 so that you get to know your team classmates as well.
Okay, thank you, Kathy. So we have another question on how much does the program go in relation to policy implementation and making assistive devices available and accessible to people with disabilities. That is core content on this course. So we have a thread of work around policy implementation, which runs through the course, which is led by Dr. Maria Kett. And we also, as part of the Future Global Technologies in Disability and Development module at the beginning, which is a large 30-credit module, then we're also teaching in there about innovation and about how to bring projects, devices, services, make those available to people. That thread continues through with the business and marketing module as well. So that you know, we had some really excellent coursework in the year gone by on policy, where people were developing and writing about policy frameworks for delivery of assistive devices in different parts of the world. And so yes, those are core content in the course, and we hope that you will find that interesting. Kathy, did you want to elaborate on that at all?
Only to say, I suppose, that part of 80-20-30, the big program that we're running at GDI Hub, part of that is to support the World Report on Assistive Technology, which will come out either in 2021, which is when it was meant to come out, which was mandated by the World Health Assembly. It may be delayed to 2022 because of COVID, but we're working on that, and I sit on the expert advisory group for the World Report on Assistive Technology, and so have access to people who write the policy in a number of countries, for India, Jordan, etc. So we tend to be able to draw on their expertise as well, and feed in the kind of process of decision making with this type of work as well.
Yeah. Okay. Thank you. So yes, in terms of projects and coursework, then we do coursework on policy making as well as and on innovation delivery as well as on technology as well. So we're not just tied to only one of those domains. Okay. I think we've covered the questions that we've got at the moment. We've also had some questions that have come in as a frequently asked questions list, which we were going to look at some of those just while we're waiting for any more questions to come from you. You're welcome to submit them. One of the questions we've had is about, can you defer your offer? And we're not accepting deferrals this time. But if you need to defer to next year, you are welcome to reapply. If you have truly exceptional circumstances, please talk to us about that. But we are not offering deferral as a normal option at the moment. One of the other areas that quite a few people have talked to us about. Oh, there's a question on the chat. Let me just read that quickly. Okay, so Fernando, I think let's have a conversation about that with you individually offline, and then we can look at your particular situation and deal with that there. So please make sure that you send us an email. So in terms of Usman, in terms of the question being a Q&A, then we've got some things we want to talk about. I'm just about to talk about careers and some of the careers options there. I haven't got lots of slides with loads of text on them. So this is more about having a conversation with you all, really. So you can ask questions as we go, I think is the idea. So let's come up to just a little bit about careers. Some people have asked us about what kind of careers people can go into after MSc DDI. So we're just running the first year at the moment, so I don't have a list of careers that people have gone into, but when the course was designed, we did that with people from a number of different industries and contexts, and it is very closely aligned with the needs of employers and of people who are working with disabled people and providing services and products and so on. So what you're learning in MSc DDI is a set of skills around problem solving in complex multidisciplinary environments, and about how to design solutions that work and that work for people with specific needs in those environments. You're learning about how to work with people from different stakeholders around supporting people with disabilities, and you're learning the language and vocabulary of people from that are working within those different domains as well. So what you have when you finish the MSc is a set of skills that are transferable into many different contexts, and those might be transferable into product design, into industrial design. You might be working in a government context, delivering services, and the skills you learn with DDI will be able to help you design services that really work for people. You may be working for perhaps in government at policy level and looking at setting policy frameworks and working on legislation which may be supporting disabled people. And again, we're providing you with skills that you can use to design that policy, to design that legislation such that it works well for disabled people. And we're giving you skills as well, practical skills for designing effective products and effective technologies as well. So it's really broad, and some of you will want to work in an international development context, and we're helping you with knowledge around disability in the context of Global South, of low and middle income countries. But the skills and knowledge that you have are also relevant in many other contexts as well. So I don't want to narrow the opportunities or narrow your thinking about where you can take your MSc DDI. I think the strength of it is its multidisciplinarity and the opportunities that gives you for working in many different contexts. So, Usman's asked about the aging population in many countries. Does the course also explore design in relation to elderly specific disabilities? We will be talking about disabilities that older people have along the way, because clearly they form a part of the spectrum of disability that people have, and many older people experience disabilities of various kinds. So yes, we will be addressing some of those. Just another question there, is the whole DDI course conducted online completely for the whole of the academic year? We are definitely delivering term 1 online. We are planning to deliver term 2 online, but we don't have final confirmation from UCL for that at the moment, but that is our expectation. And term 3, the dissertation term, we are expecting to deliver that online as well. So that is the plan. That's the most definite I can be at this stage, but we will obviously provide you updates on that as soon as that is confirmed further by UCL.
Can I add something just to the dissertation part? So also there will be some option for each supervision. So each supervisor will be able to have some face-to-face supervision, but there will be some UCL guideline. At this moment, we can't guarantee, but I cannot say they will be just only done by remote supervision.
Okay, thank you, Youngjun. There's a question about from a person looking forward to receiving an offer, and are there offers yet to go out? Aisha, could you clarify that one for us?
Yeah, we have quite a few offers waiting to be issued. So once we make a decision in department, it usually takes about 2 to 3 weeks for admissions to process and send off offer letters.
Yes, so the answer is yes, there are still offers to go out.
Yeah.
And we are still accepting applications as well. So applications close towards the end of August.
Tim, could I just quickly go back to that ageing question? Would you mind?
Sure.
Second, one of the things that's been discussed a lot within the UN space is the aging population with regards to assistive technology. And what we've found over the years is that assistive technology for a long time has been quite a kind of niche area of design, but that with the aging population, some of these niche areas are becoming much greater. They're much bigger market sizes, and that's crowding in more designers and more innovators into that space. So I think although we don't have a module on, say, aging, it bubbles along. Especially in my module, we definitely have a couple of lectures that specifically look at functional decline due to aging and also market opportunities and things because of that. That was all, Tim.
Okay, thank you. So that's really what I was trying to say about. Thank you for that on the aging, Kathy. On careers, then, what I'm trying to say there is to encourage you to think quite broadly as to where you can take your MSc DDI. It's multidisciplinary, and that gives you opportunities to work in many different contexts.
Sorry, Tim, I'm going to be annoying again, but I just wanted to, because one of the things on the careers that's come up just even over the last 2 years is that, or 2 to 3 years, is that Microsoft, for example, and Google have grown huge teams in accessibility. So if you're interested in the kind of HCI digital space, there's now huge teams happening there. But interestingly, in the policy space, where disability was quite sidelined, so it was always just in like work and pensions and quite a small team in there. It's now, there's a big drive to mainstream it, and we're increasingly finding jobs around assistive technology and inclusive design being sent to us for our graduates, from everybody from Leonard Cheshire International to Disability Rights UK, but also some tech startups and tech and the larger tech firms.
Okay, yes, thank you, Kathy. I think this would be a good point perhaps to talk to Kate and about some of her experience of doing some design work within MSc DDI, which has led to an award for her. So Kate, could you perhaps tell us, how did you get started on your design project? And perhaps you could tell us just a little bit about that to start with, as to what it is that you did.
Sure. Hello, everyone. So yeah, my name's Kate, and I came onto this course with a physiotherapy background. So I've come from a healthcare background and didn't know anything about design, knew very little about anything technical. And I think that I was drawn to the course from the global aspect and the disability aspect. And then through doing this course, and it's like Tim has been saying and Kathy's been saying about the fact that this is so multidisciplinary, and the collaborative approach that you have with others that have come from a completely different background, so different parts of the world. And then also, you know, I was working alongside computer programmers and designers, and you learn these kind of new approaches and ways of thinking about problems that you haven't before had to do or had to use. And so so I took the inclusive design module, optional module, and for this the brief that Ian set was quite similar to the RSA brief, which is an organisation in London that is focused on kind of driving social change through design. And I just quite liked the brief. I was quite inspired by the brief. It was to do with healthy roots, and it was to do with the aging population, which is an area that I do have interest in. And it was about thinking, how can we you know, encourage older adults to remain active, and also to be able to access services that they otherwise wouldn't be able to, especially in kind of rural parts of the UK and globally as well, where transport is always one of the big barriers for many people. So from that, I kind of used those skills that I'd learned in the design thinking module from Loughborough, just to approach the problem and break it down in a way that made you kind of look at all these different things that might factor into somebody's life. And from there, proposed this idea of basically a side-by-side electric tandem bike that would be supported by a volunteer community. And so it wasn't just necessarily about the device itself, but it was very much about how that's implemented and what kind of business plan it might need, and what service and who would need to be involved. And so it was you know, it did take in all those different aspects that we've been taught from the course to think about. And so yeah, I was very pleased to find out that I had won. And I think that what it really showed is that I almost laughed at myself entering the competition, because compared to a lot of the other images going in, you know, from people who were from a design background and had lots more software skills than I did, they were able to put in very beautiful images compared to the kind of sketches that I was just about, you know, able to pull together. But it wasn't about that. And I think that that's the thing, that you have the chance to kind of realize the potential that you didn't necessarily know, or adopt different skills and put together something that otherwise you wouldn't have been exposed to. And I've definitely learned a lot, and I think that there are skills that are for sure transferable to whichever area you go into thereafter. So yeah.
Thank you, Kate. Kate, you came to the course from a clinical background, from physiotherapy, and now, which is something that you're still involved in and still doing. But do you think you're thinking about disability and technology and so on? Has that shifted during the course of this MSc, or do you think you still see things in a similar way?
No, I definitely think there's been a shift. I suppose from a kind of rehabilitation background, which is where I've come from, like we're often taught to think in quite a holistic way. But for sure, like I've had to think about things kind of, I've really enjoyed being outside of a healthcare bubble and being outside of this clinical environment where you still, even though you approach stuff holistically, you still probably come at it from a medical background and thinking maybe like conditions rather than just you know. And something I think that this course teaches you is about the innovation aspect and thinking about how you can frame it in a different way to not necessarily come from that clinical side, but just more of this way of thinking about all the kind of possibilities that are out there. And actually, so I guess yes, in a nutshell, it has definitely taught me a different way of thinking.
Great. Thank you. And just one last question for you. Perhaps could you give our offer holders some advice on how perhaps they should approach the course, and what they should be thinking about getting out of it when they're doing the course and involved in all the modules and the teaching interactions that are going on?
Yeah, I would say be really open-minded. Like, I think don't come in with a set expectation of what you're going to get out of it, because like I said, we all came from such different backgrounds, and this was like one of the greatest things about the course. It also made it challenging at times because but really interesting. And I think that the course is set to meet the needs of such a diverse group. So there's going to be, you know, there's no set one direct path. So I think come into it really open-minded, and that's you'll get the most out of it. And there'll be some modules that will really kind of connect with some people and other ones that will connect more with others. But the way that the project work is designed at the end is that you can shape your project to be more particular for your interest, and that's where you can really probably get the most out of it that you want as an individual, because you're not going to have the same expectation as the person next to you, because they probably want maybe a slightly different career. So just be really open, and I think there's loads to learn from other people. I learned loads from the other people on the course, and yeah, enjoy it.
So I think you've picked up there, Kate. Thank you for that. There's one of the things within the course is that everybody comes to the course with some expertise in something that we're going to teach. I think everyone's going to find one or two of the lectures at least quite easy, and probably material they've covered before. But that's okay, because we're not just teaching you knowledge. We're not just teaching you about disability and technology and innovation. What we're trying to teach you is about making the links between those different things, and it's about thinking across boundaries and thinking about interconnection and innovation in that context. And one of the things that we really encourage is for people who have different expertise to be able to support and to one another within the course. And we want you to work together as a group. We want your work to be your own work when you're making submissions and doing assignments, but we do see that there are opportunities and meaningful ways in which you can help one another with all the different areas of expertise that you have. Kathy's picked up a couple of questions that she'd like to ask. One of them on research methods differing from human-centered design, and another one on building prototypes. If you could pick up those, Kathy, please. Kathy, you're muted.
Before you, Kate, there's a question coming to you as well from Taco, and I also wanted to ask you what's next after the MSc DDI, but I'll answer the other two first to give you a chance to think. So the first, I don't know who this has come from, they're anonymous, but to the anonymous attendee, there's the focus of accessibility and assistive technology. It's the human-centered design principles are not different for disabled people. So if you were taking the standard MSc HCI course, we use standard methods to work with people who might consider themselves disabled and have, for example, autism, or people who live with chronic pain, or people who are suffering from early onset Alzheimer's, or people who happen to use a wheelchair. We use the same design principles. That we have begun to adapt some of them within GDI Hub, but a lot of that's to do with more, as Kate was saying, about the innovation side. So there's a lot of technology and a lot of ideas that get stuck at the idea and proof of concept stage. And so we're working very hard to make sure they get out to people. So you don't necessarily have to do face-to-face. We've been doing things like, so we had to adapt, Kate, you can talk about this, we had to adapt with no notice for COVID to online teaching for the end of last term. So we had absolutely no notice that COVID was coming, and then 1 week we were teaching inside and next week we were not. But we've managed to adapt all of the coursework. So I had maybe 60% of my 40 students were doing design-based work, and we moved it to online methods. So as an example, even now some of my PhD students are developing prototypes for visually impaired people, and we're posting them to people, and then we get them to set up their webcam, and we do an out-of-box experience where they talk through how they feel about this device, and then we ask them to do things, and we observe them just from the webcam. There's an awful lot of interviews that can be done online. We use Microsoft Teams so that the data can remain in the European Union, and nearly all interviews have moved to remotely. So there are lots of ways for you to adapt some things. I don't think if anything, it's been really exciting. Some of the ingenious ways that people got to test their different prototypes and went out of their way to adapt co-design methods to remote was really exciting to read. I was really impressed with the assignments that I was reading a couple of weeks ago. So I would say that the adaptations and methods are actually greater for how we deal with delivering research and practice online and remotely, and even just within, because London, I mean, presumably nobody knows if the second wave will happen, but at some point there will be some ability to interact with people. So you will be able to go to a park, for example, and be able to give a device, and then they would be able to test things, or we'll just hold the co-design session outside. So I think we can adapt, but those adaptations are much greater than the adaptation between standard HCI methods and methods for disabled people. And I would just pick up on something you said, where you said, how do we test on them? We never use that. We try not to use that language. So them is very othering. It's like they're over there, those people. So I don't know if anybody on this call believes they have a disability, but I know of some people on the call who have a disability, and a lot of disabilities are not visible. So we would work with everybody, disabled people and non-disabled people, to develop things. So it would be co-designed with people in any case, and they would be part of the testing process. And so people are able to tell you how we can adapt, and we can adapt the method together of how we're going to design and test in the world of COVID. So I think it's more of an exciting time, actually. As for whether or not you get access to the labs and things, I'll let Tim and Yongjin update on that, because the guidance seems to change daily and I don't keep track of it. So I'll let them do that. But I think I might just hand over to you, Kate. And if Mr. or Mrs. or non-gendered anonymous attendee would like to come back to me, please, I'd be happy to answer more on that.
Yeah, thank you.
Email addresses, they are on the UCL and MSc DDI websites, so we'll provide those. Yeah. Sorry, Kate. Go on.
No, it's fine. So the question about the online mode of the course and how will it affect the possibilities, and offers of the creative environment? It's definitely a great question. And I think, like Kathy said, we were thrown into having to complete our final module online, and it was group work as well. So it was part of the collaborative project. So we had to kind of, so we were working as a group and also working with a project partner, Ford, and it made it challenging, but also it in some ways pushes you to be quite creative with how you go about completing project work. And there are like lots of tools and kind of softwares that you can now utilize, which just helps with almost kind of brainstorming online. And strangely, I also found it could be easier as well, because I think you had the opportunity to really discuss ideas and then pause and go away and think about it and then come back and rediscuss it. Whereas sometimes when you're always together and always in the group, it can be quite tiring and fatiguing. But actually almost utilizing the online and the opportunity of that is that you could explore more options, and people could, you know, input verbally as much as they want or type their answer, and everyone just has a different way of thinking around a problem. And I think that maybe you can utilize more of these things rather than just when you're sat in a group. So there is perks, and yeah, I think, I don't know if that answers your question, but I'd say just utilize the tools that exist online. There are different softwares, and I'm sure you'll learn more about them when you come to doing those modules.
Okay, thank you, Kate. Sorry, I've just lost my thread for a moment. Yes, one of the things I wanted to say briefly. Yes, so I've also been doing some research with a project called Prime VR2, where we've been developing VR systems and controllers for people with disabilities. And also, we were impacted in that project too, and I'm leading the user engagement work for that. But we've adapted and we've found ways of working with disabled people remotely. And I see this current situation as a bit of an opportunity in many ways. It is hard, but it's an opportunity as well. And I think for people to come out of MSc DDI with a set of skills that mean they can work remotely and do research and do design with people who are distributed and scattered across the world in many different places, is actually a really valuable skill set. And you will have stronger skills in that remote distributed working than perhaps you would have had if you were attending fully face-to-face, and there would have been a different emphasis in the course. So I look upon this as being perhaps different rather than limited. And the skills that you're coming out with because we're working remotely and online are actually really valuable and transferable into your future work context. Okay, on that subject, then we've just do a little bit of a roundup on some of the involvement that the Global Disability Innovation Hub has had around COVID-19, and some of the work that we've been doing to help support people, and some of the innovation work that we've been doing. And perhaps the first one that we'd like to talk about is Innovation Action, which is a website and innovation support that we're currently developing. Kathy, could you tell us a little bit about Innovation Action and the work that we've been doing there?
Sure. So Innovation Action, if you go to innovationaction.org, at the moment you'll probably see what I think is a relatively boring website, if I'm honest. We're in the process of redesigning it. That was the kind of beta version that we put up. But the idea was that before COVID happened, we had been doing a lot of work on assistive technology. And what we had learned was that there were two to three core problems. One was that products were often not fit for purpose in the country or the domain in which they were trying to be used. And so we needed local solutions. And those local solutions needed to be able to be repaired in country and locally. On top of that, policymakers had very little data, and that also went for new innovators. So you didn't know where the potential users of your device were, and policymakers didn't know where where disabled people lived or persons with disability were living, and therefore didn't know how to budget. They didn't know what is the number of wheelchairs or number of prostheses we need to supply in a country or in a region. And so we realized these were problems, and we had been working on them. And then COVID came along, And we watched people do exactly the same thing as what we've been seeing happen in assistive technology for many years. So all of a sudden COVID happened and everybody wanted to be an expert in designing a ventilator. Hundreds of ventilators were designed the world over. And I can't tell you how many people contacted us and, oh, we're going to design a new ventilator. And then, you know, they might have designed the ventilator, but a couple of weeks into that, they suddenly realize, oh my God, there's standards that I need to adhere to. And then they might get the standards right, and the standards might change and they might have to adapt it. But then even when they get the product ready and it passes the standards, they're then like, oh, how do I manufacture this? How do I scale it? And then they say, oh, actually the biggest problem might be in Africa. Okay, well, is there oxygen supply in Africa? In the hospital networks? No, not here. Okay. So then they suddenly realized they needed data. They needed data on where oxygen supply was, but they also needed local solutions. So we began to realize that we weren't the only ones. There were other problems in this space. So we're developing a platform that basically allows us to host open designs using the open know-how and new open standard for sharing products, and matching innovators of new designs with where they can get things sourced, their parts sourced, but also manufactured. So trying to do matchmaking between manufacturing globally and new devices. And secondly, we are going to be a portal of data. So as these devices go live and we begin to get usage data and survey data and all the other data that we collect, it will all be going live onto this portal. And the idea is that we would be able to conduct different innovation actions for any particular challenge. So at the moment, somebody might come along and say, actually, you know, in a year's time, the biggest problem is we have a challenge of greenhouse emissions, or like carbon emissions and the aging population. We want to make transport accessible, for example, and we can have an innovation action around that space, where we would again begin to look at designs and how we get designs to market, and again provide data back to people. So one of the things is that, having been in UCL for many years now, you get a lot of funding. So we have £20 million for a particular project at the moment, and then that funding runs out, and then you move on to the next pot of funding. And I suppose one of the things I want with Innovation Action is to make sure that data that's collected under different funding pots is made available beyond the life of the project. And so we're working with the Institute of Healthcare Engineering, the Institute of Making, STEEP, who are the policy arm of the engineering faculty, as well as the Frontier Tech Hub, who do innovation practice for the Department for International Development, and of course the Global Disability Innovation Hub, CIC arm, the Community Interest Company arm. But it's good fun at the moment. We're about to, a couple of weeks, there'll be a new site, and it will have some nice data graphics and things, and hopefully make a bit more sense than the current version. Do add, Tim.
Okay, so yeah, so MSc, sorry, not MCDI, the Global Disability Innovation Hub is looking to how we can support innovation at a high level and enable people to make the connections and links that are useful to them. And I was also involved in one of those ventilator projects, and the need for that connection and facilitation was really clear as we were working through and dealing with the difficulties and problems that we were facing there. So I think also it's an opportunity for us in this current situation to look at doing some research as well that we want to do to understand those processes of innovation, of rapid innovation, and look very clearly where the needs are and what are the best things that we can do and the best solutions that we can find. And we're applying the methods and that we're learning within MSc DDI into that context. And that multidisciplinary approach is helping us at GDI Hub to be able to address some of those really quite complex and entangled problems. Are there internship opportunities for GDI partner organisations? That's something that we would like to set up. We don't have a formal process for that at the moment, but we do expect to be able to have some internship facilities for next summer, but we haven't done that yet. That's work to set up at the moment, but we would like to be able to do that. We'd like to ask you some questions as well, perhaps. We've got some polls that we can run. We're just nearing the end of the session. So perhaps could I ask you just a quick query about your background. So are you from an HCI background? Are you from a clinical background? From development? From, there we are, look, there's an education background. That's good. So I'm just trying to understand, what's your thinking, background, where are you from? Can we ask you to vote now on the poll?
Going to leave it to run for about 15 more seconds.
Yep, okay. Aisha, we have an anonymous attendee has asked a question about CAS. Myself, I don't know about CAS really. Can you answer that question, or do we need to come back on that one?
Is it in
it's in the questions, yeah.
Okay, I can't see the questions.
Okay, it says, at the time we have to come back to London, will we receive an accurate email to apply for CAS?
Okay, can we take that one offline?
Yeah, we'll come back to you with that one. That does mean we'll need some contact details for you. If you could email it to me, which is t.adlam@ucl.ac.uk, we will be able to come back to you with a better answer for that.
Usman is pointing out that business wasn't an option on the
Fab, we'll take a
okay.
note of that one.
Can we add business as an option?
Not right now.
And in future, but we can definitely put Mark next to Usman now.
Yeah, thanks, Usman. We know where you're from. Okay, are we there on the survey?
Shall we share results?
Let's share the results. Let's see where we're from. Oh, lots of engineers. Oh, I'm an engineer, so but that's actually a good mixture of people. It's good to see some healthcare and arts people and social science and sciences as well. So that's quite broad. I'm guessing if the engineers are covering the design and things as well. Okay, so another question that we want to do, which is helping us think about planning actually, is also which region of the world you're from, or which time zone are you from? Because we need to make sure that we can make sessions work for you, whichever time zone you're in. And so it would help us if you could just tell us just whether you're plus or minus GMT and how many hours. Aisha's probably typing like mad now because I've just given her.
You've just given her a random one.
I've just given her one that she wasn't expecting. Okay, are there any, whilst Aisha's doing that, are there any more questions that you want to ask us? Oh look, there's an easier way of doing it. It's just to put those in the chat. Actually, we could do those in the chat, couldn't we, or in the questions?
That'd be a lot more quicker.
Yeah, let's do that. Did you have another poll, Aisha? Just to have one more to run.
I've got one on whether a question about whether you'll be coming to London in September.
That's the good one. Yeah, let's put that up and see how we go.
So that one should be visible.
Yep, we can see that. Maybe we should have a maybe on there as well.
That's a good one as well.
Okay, any more questions? If your scholarship requires you to be in London, does UCL help with accommodation? So your scholarship includes, the gold scholarships include funding for living costs. UCL does have an accommodation office and so is able to help people find accommodation. Is there accommodation here East Campus? No, there isn't, but there is accommodation in the community around here East in East London. Other questions there?
Can I just make a quick note, Tim, on one thing about the scholarship, the gold scholarship, and that's just that if you're an international student, it will probably only cover your fees, and it will be up to you to make sure that you're able to cover your living costs. So Snowdon Trust normally give normally their studentships cover just home students, and because of the nature of GDI Hub, we wish to extend that, but it doesn't mean that the amount extends. It means that we're allowed to offer them to overseas students, but you must make sure that you're able to cover your own costs when beyond, because it will be more. Your living costs will be in addition. And when you sign your declaration for the visa, that's what you'll be stating that you're able to do.
Just to follow up slightly on that, just to say that Snowden scholarships have now closed for this year if you haven't already applied. If you've already applied, then we're just going through the process of the selection process and working alongside the Snowden Trust for that. So you'll be hearing of the outcome of that in the next week or two. But unfortunately, the application process has now closed for anyone who hasn't already applied. And those scholarships were available for disabled students who were disabled leaders of the future, and there is potential opportunities for future scholarships on the course as well, but for the 2020-21 year they've now closed.
Thanks, Louise. Okay, it's now 10 o'clock here in the UK. We're going to wrap up. Can we, did we get any answers on the poll? Can we see that one?
Just show the results now. So quite a lot of people are interested in coming to London.
Yeah, so lots of you want to come. Great. It will be good to see you. Okay, so.
And we will also use that data to lobby internally within UCL to try and get access to labs and things if we don't.
Yes, I think we should. Yep. Let's make sure we save that one, Aisha.
Absolutely.
So thank you all for coming. Are there any last minute questions that we can answer quickly?
I think one question we got is about the difference between HSCI program and DDI, especially in terms of a research method. And we already answered to that question. But one thing I wanted to just highlight is a couple of students have tried to make their coursework to become a published work at some of the HSCI venue. And one was successful, and that was published at CHI. So from my viewpoint, the research method you will be learning about will be very similar to what you could learn from the HSCI program. And I don't think there will be some, any kind of differentiation or any bias between the two backgrounds. So that was something I just wanted to add.
And we have 4 or 5 students putting papers into ACM assets as well for the late work. So I don't see any problem.
Meti, you've asked about difference in attending in London in term 1. That's up to you. All the teaching content will be accessible online. So you are very welcome to attend in term 1. But we're not expecting you to attend in term 1. If you do, then we will be running some face-to-face in-person activities for you to be involved in. Plus there's all of the London experience and the clubs and societies that we run in UCL and so on as well. So there is all the UCL university things that will be happening, and the library and so on, that will be there for you if you come to London.
But I think all group work, anything to do with actually the things that you will be assessed on, will be done online, regardless if you're in London or if you're in Japan or if you're in Nigeria. Okay, well, it's nice to meet you all. Hope to see you soon. Take care.
Do email us if you've got further queries, and we will come back to you on those. Email addresses are on the UCL website, and I think you can also contact us through the Global Disability Innovation Hub website as well. Thank you very much.
Thank you very much.
Thank you.
Bye.